If you suffer from autoimmune disease, then chronic infection is an area that needs to be investigated in your case. There are many patients who suffer from autoimmune disease that do not get the symptom relief or the clinical improvement that they want because their clinicians do not know about or do not investigate viral burden or chronic infectious burden. Now, we're not talking about acute infection. In acute infection, it's obvious. On your CBC, your white blood count is lab high. Your differential is skewed in a certain direction. With chronic infection, all of the markers on your CBC are going to be normal to a medical doctor, so they're not going to even think about chronic infection. Functional medicine, as I hope you know, looks at labs differently, so even within the medical normal range, you can have deviations that are giving us clues as to, say, a chronic infection or something that is out of whack but not quite bad enough to be lab high or lab low. So if you have autoimmune disease such as Hashimoto's, chronic infection may be driving your symptoms or worsening your symptoms or leading to flares. For example, many infectious diseases or microbes are associated with autoimmune diseases. Hashimoto's has high association with epstein-barr virus. So if you have a chronic epstein-barr infection, that could be driving your Hashimoto's symptoms, and the improvement that you're looking for may not happen until you deal with the chronic Epstein-Barr infection. If you have type 1 diabetes, Coxsackie virus is highly associated with type 1 diabetes. So if you have a chronic Coxsackie virus infection that isn't being addressed, your type 1 diabetes may not improve to the point that you would like it to. Now, you're allowed to have multiple chronic infections or a high viral load from multiple viruses at one time. For example, the herpes family of viruses is very common. So you could have Epstein-Barr virus, human herpes virus 6, and herpes simplex virus 1 on board all at the same time. If you have that versus just an Epstein-Barr virus on board, the immune system is more taxed, and it's going to be even harder to beat 3 viruses than it would be to beat 1. So if you have autoimmune disease and you are being managed by a doctor and you're not happy with the results, then finding a clinician who's going to look at chronic infectious load would benefit you. Functional medicine practitioners are trained in looking at chronic infectious load, and in your case it may be the difference between living a life at optimal and living a life of autoimmune flares.